Plasmodium falciparum. What is Plasmodium falciparum? Plasmodium falciparum is the most dangerous malaria parasite, responsible for the majority of malaria-related deaths. It is a single-celled eukaryote with a complex life cycle, involving both human and mosquito hosts. The parasite has evolved mechanisms to evade the host's immune system, including the expression of variant surface antigens. Plasmodium falciparum has developed resistance to many anti-malarial drugs, including chloroquine, which has complicated treatment efforts. How does Plasmodium falciparum cause cerebral malaria? Plasmodium falciparum has the ability of red blood cell manipulation. Plasmodium falciparum alters the surface of infected red blood cells, causing them to stick to blood vessel walls. This process is known as sequestration. It can lead to blockages in small blood vessels and complications like cerebral malaria. What are the characteristics of Plasmodium falciparum? Plasmodium falciparum is a parasitic protozoan that causes the most dangerous form of malaria in humans. Here are the characteristics of this parasite. Transmission. It is transmitted through the bite of infected female Anopheles mosquitoes. Erythrocyte infection. Plasmodium falciparum infects red blood cells of any age, and often multiple parasites can infect a single red blood cell. Severe complications. It can cause severe complications like cerebral malaria, patient shows impairment of consciousness, seizures, severe anemia, and acute respiratory distress syndrome, high parasitemia. Plasmodium falciparum infections can lead to high levels of parasitemia, often exceeding 5%, which is a marker of severe malaria. What are the microscopic features of Plasmodium falciparum? Plasmodium falciparum has distinctive microscopic features that help in its identification. These include ring-stage trophozoites. These are the early asexual forms of the parasite, and they are often seen as small rings in the red blood cells. In Plasmodium falciparum, multiple ring-stage trophozoites can often be found within a single red blood cell. Schizonts. These are the asexual forms that divide to produce merozytes. Plasmodium falciparum schizonts are rarely seen in peripheral blood, as they tend to sequester in the capillaries of internal organs. Maurer's dots. These are small reddish dots or clefts, seen on the surface of infected red blood cells, particularly in thin blood smears. They are not always visible. Maurer's clefts are membrane-limited vacuoles or sac-like structures in the cytosol of the erythrocyte, formed early after invasion by the parasite, visible as blue dots in GMSA-stained blood smears. Infected red blood cell appearance. Plasmodium falciparum can infect red blood cells of any age, and often does so multiple times within the same cell. Infected cells may not be significantly enlarged, and they may adhere to the walls of capillaries. This phenomena is called cytoadherence. Formation of hemozoin pigment. The parasite produces a dark pigment called hemozoin. That can be seen within the parasite, and in the cytoplasm of infected red blood cells. The dark pigment, hemozoin, is a byproduct of the malaria parasite's digestion of hemoglobin within red blood cells. This pigment, visible as dark granules, is found both within the parasite itself, and in the cytoplasm of the infected red blood cell. The formation of hemozoin is a detoxification process for the parasite, as it converts toxic heme into a less harmful, crystalline form. Gametocytes of Plasmodium falciparum. These are the sexual forms of the parasite and are a key feature for identification. Plasmodium falciparum gametocytes are elongated and crescent or sausage-shaped. They are typically about 1.5 times the diameter of a red blood cell in length.